The next operation I'd like to talk about is a coronal or a brow lift. And I think in discussing the complications with a coronal lift, I think it's important to understand what is the difference between a blepharoplasty and a coronal lift. A blepharoplasty will take away the excess skin from the upper eyelids. It does not elevate the position of the eyebrow. That's what a coronal or a brow lift does. They're complementary, but they're two totally separate and distinct operations. Now, again, you can have bruising, swelling, infection, bleeding, scarring. Now, when we do a coronal lift, we usually will make the incision in the hairline. Now, theoretically, if you go ahead and do the incision in the hairline, you could have areas of alopecia or loss of hair. Now, fortunately, that has not occurred to me, and it's very, very uncommon. People frequently will ask me, well, if I get a brow lift, are you going to shave my head? And the answer to that is no, I do not shave the hair. Now, when you do a coronal lift, it's important to understand that the hairline can be elevated, so the forehead can be higher up. So in circumstances like that, we many times will take and make the incision in front of the hairline. That is right in front of the hairline here, and then taper it into the temple area. So if somebody has a very high forehead and we don't want to raise it up even more, then we may make the incision in front of the hairline. My experience over the years has been that these generally do quite well. Another complication with a coronal lift is sensory nerve loss. Generally speaking, the nerves on the forehead go vertically and up. You have the supratrochlear and the supraorbital nerves. Now, when you make the incision for the coronal lift, those little sensory nerves are generally injured, damaged, cut, whatever. And so you may have some sensations of needles and pins, prickly sensation, ants crawling on my skin. It can take a long time for those to go ahead and regenerate. Now, it doesn't affect the final outcome. You look better, you look more youthful, but it's important to understand that, many times patients will come back to see me 2 months post-op and they'll say, Dr. Brueck, when I brush my hair, it feels kind of weird or funny, and that's normal, but again, it does not affect the way you're going to look. So it's important to realize that that's a normal part of the healing phase and can take some time to resolve.